This week, we are talking about a lesson we learned the hard way.
Yes, and that's that pacifier use can sometimes do harm. If this is your first time meeting us, I'm Kurt. I'm a board-certified pediatrician and dad of 3.
I'm Sarah. I'm a board-certified OBGYN and mom to those same 3.
Yes, and we are the Doctors Bjorkman. Welcome back. It is important for us to say this week as we're talking about pacifiers that there are actually some really good uses for pacifiers, and we definitely don't want to give anyone guilt about pacifier use for their child.
Totally.
We have 3 children. Our first used hers until she was about 4 months of age.
Yep.
Our second used his past 2 years of age, and our third just hasn't really liked them. But there are some issues that can come up, but the good benefits of pacifiers really come down to helping your baby learn how to self-soothe.
Yes.
That sucking behavior, we did an episode all about how to calm your crying baby. That suck is this non-nutritive suck can absolutely help calm them.
There is also some data that it reduces the risk of SIDS.
Absolutely.
And so the AAP definitely says, hey, pacifiers may help reduce the risk of SIDS. These are wonderful till 6 to 12 months.
Yes, so if you're using pacifiers in that first half a year to a year of age, kind of very minimal risks and actually mostly benefit, especially in those first 6 months of life. But I think there are some important things to think about, whether you're trying to breastfeed and how the use of pacifiers may make that challenging up front. We'll talk about that first, but then also how prolonged use can potentially cause harm in the way their face and mouth forms.
And be sure to stay tuned to the end. We are going to share some tips and tricks for weaning the pacifier, whether it is with your 4-month-old or your beyond 2-year-old.
Yeah, we've done both.
Yep. So first we're going to talk about pacifiers for little newborn babies.
Yeah, so as we already mentioned, there are some benefits, and one of the biggest ones is the reduced risk of SIDS, or sudden infant death syndrome. There's actually been a meta-analysis, so a big study combining all the results of other studies that has shown a 50 to 60% relative risk reduction, so less risk of sudden infant death in babies who use a pacifier. So there's definitely some protective effect that this is associated with, that like, hey, at least pacifier use during sleep maybe helps them with stimulation or something else be a little bit safer in sleep.
Sure.
But there are some concerns too, right?
There are. And so the things we're thinking about with a fresh newborn baby really revolve around, hey, is breastfeeding one of your goals? And if it is, they can be a little bit complicating and you want to be thoughtful about it.
Okay.
So number 1 is thinking about nipple confusion. Number 2 is thinking about breast milk supply. So you have a newborn baby who's fussy and you put them to the breast and they are sucking, and that is establishing your milk supply. Baby is working on that latch, that proper how to form that latch with their mouth, their little tiny anatomy, and that is very different. That nipple is very different than a plastic pacifier, even the ones recommended by the SLPs. So there can be nipple confusion.
And the soothing part, I will say, like as the non-breastfeeding partner in this duo here, there are times where that pacifier is so helpful in terms of like, hey, we did this video all about how to calm a baby. And part of that is that non-nutritive sucking, them having a pacifier to suck on, does have a lot of calming effects. It can help with pain control, things like that. But definitely what I hear you saying is, hey, it's great if mom can do some of the calming to help get her milk supply in.
As the person with nipples, also getting a break and having baby be able to do some non-nutritive sucking elsewhere is also very important for mom in those early days. It's just one of those things where you want to balance this. I notice with the early babies, when you give them a pacifier, their suck is definitely different. They're a little like, wait, when you transition between
even now,
the two.
like going back to the boob after sucking on a pacifier, you feel
especially with Hank, yes. So the other thing we're worried about is establishing milk supply. Hey, you have a fussy baby, put them to the breast, stimulate milk production, soothe the baby. That's option 1 then. Or hey, you're going to give them a pacifier. They're fussy. They are soothed with that pacifier and you don't end up breastfeeding, and then you aren't building this supply that you really need to lay down in those early days for baby. So protecting the milk supply and making sure baby has a good latch are 2 things you really want to work on in those early days.
And that's really mostly for the first 4 weeks or so?
3 to 4 weeks is so baby friendly. USA kind of recommendations say, hey, give it 3 to 4 weeks till breastfeeding is better established. Again, the studies that look at this, that look at moms who are highly motivated to breastfeed, actually show, they did a randomized controlled trial, that it did not impact breastfeeding up to 4 months in moms who are highly motivated to breastfeed. So
if someone really wants to breastfeed, like use a pacifier, but be a little bit thoughtful.
Just be thoughtful about it. Yes, there are some risks, certainly. So be thoughtful about it, for sure. Usually 3 to 4 weeks. We have certainly done it sooner.
The next big thing to be mindful of and thoughtful of with pacifier use is prolonged use. So as we've already said, there's recommendations that pacifier use is totally fine for the first 6 months to 12 months, and even up to 18 months, depending on who you're getting your recommendations from. The big concern though is with use past 1 to 2 years, that sometimes that prolonged sucking and that like having a pacifier in their mouth is actually going to change the way their mouth is forming, the way their teeth are coming through. Does it create a situation for crossbite, overbite, crowding of the teeth?
And not only that, around 12 months of age to 18 months of age, our little ones are starting to say their first words. This can impact their speech development and ability to speak. And so for that reason, it is time, that's around the time you're supposed to start thinking about weaning the pacifier.
Yes, and so please don't feel guilt about this.
No.
As we mentioned, our second used his pacifier past the 2nd year of age, but this was actually something we noticed. We were seeing a lot of crowding, a lot of like crossbite with his teeth. I'm like, oh shoot, like this is from his pacifier. Now
100%.
he loved the pacifier use for calming, but what does the data say about this? There's actually some really nice randomized control trials that have been done on this. One actually recently just published last year, looked at children who used their pacifier through 2 years and then had follow-up evaluation at 7 years to say, hey, does pacifier use in those first couple of years, if it extends through that 2-year mark, change their teeth pattern as they're older children? And actually it did find a significant difference in increased risk of crossbite of their teeth if they're using their pacifier through 2 years of age. Also notably, you may be thinking, what if they're sucking on their thumb, their fingers? That also can lead to crowding. And so it's kind of this learned behavior of, hey, I'm self-soothing by sucking on something that does have a potential risk for how their mouths and jaws are actually going to form as they grow.
Now there is some thought that discontinuing in that 2 to 3 year mark, a lot of things will and can self-correct. And so if you find yourself where we did, you're in that 2 to 3 year mark, we are going to share some tips for tricks to try to wean that pacifier.
Yes. The other question is like, hey, are there certain pacifier shapes or textures that can be more helpful? And a couple of things that we'll say is definitely there are certain shapes and textures. So the first thing that we just caution you against, there are some pacifiers that are incredibly stiff and rigid.
Yes.
Those are the ones that are going to have the most just direct pressure on the palate,
And when they're
the roof of their
sucking,
mouth, that can really kind of exaggerate kind of the potential problems with how their little mouths are forming.
Yes, SLPs tend to
That's
love
speech language pathologists. Okay.
Yes.
They're the experts in little baby feeding, speech learning.
They tend to love the Avant Soothie. Okay.
And this is the really soft one, not the hard one.
You know, the 0 to 3 month.
Okay.
Fine forever.
Okay.
The Ninny, this is the Ninny Co. This is dear sweet Bo when he had his tongue tie and we'd work with the occupational therapist. She loved the Ninny. You can kind of see their suck through this pacifier. It's very different than the other, but they loved this.
And the Ninny is a little bit more nipple shape like, kind of?
Sort of.
Okay.
But sometimes part of therapy, feeding therapy, things like that, is suck training. And so we use the Ninny. He didn't love this one, but to work on suck training was something that we certainly did. And so these are two that generally OTs, SLPs love. Things they don't love, any of the pacifiers that have like a stuffed animal attached, that's a no.
Because it just forces them to suck so much harder,
Well,
and
and
really
it's just heavy. It's just pulling down on their tiny little
They're
mouths.
very cute.
They are, the wubba nubs or whatever,
Yeah.
but not great for oral myofascial development. So simple is great.
So as we mentioned, we've had 3 children who have had 3 very different pacifier experiences.
They sure have.
Let's see. Cecilia was first. For her, actually, we just decided she kind of liked it. She wasn't crazy about it.
Yeah.
Used it often to help go as a sleep. And
Yeah.
we decided, hey, when it came time to do sleep training, sleep learning, like we didn't want her to be in a crib of 8 pacifiers in case she wanted to find it in the middle of the night. We just said, hey, while we're doing sleep learning, we're just going to get rid of the pacifier at 4 to 6 months of age.
Yep.
We said it was done, and
Cold
honestly,
turkey, done.
that was great.
Yes.
The downside of that, though, I will say, is she was a pretty fussy and hard to soothe baby from 6 to 12 months, 12 years.
Yeah, we'll see.
And so we lost that tool of soothing that we didn't have with her.
Yeah. That was tough. Bo, dear sweet Bo, I mean, well, Bo's going to be the long story. Hank just like straight up didn't like it.
Baby number 3.
Baby number 3, didn't care for it.
Never really soothed with it well.
Nope. And I remember very early giving it to him like in the hospital. Yes, I packed pacifiers for the hospital, especially if you're like at a baby-friendly hospital, then they don't necessarily have them always. So definitely packed them. I think I offered him one. Didn't really care for it. And I could tell his latch was different. His suck was different. He was a little confused. And so I said,
You were worried about establishing breastfeeding well and didn't want pacifiers.
But sometimes the nipples need a break when they're just doing that non-nutritive sucking.
So he just went and cried Dad's arms.
Yeah. So anyway, that was Hank. He never really liked it. So cool.
Yeah.
And that's
Bo,
Sweet Bo,
baby number 2, came along when he had a 22-month-old sister who was just spirited, and so we just loved that he loved his pacifier because it made it so easy to put him down.
Or be happy in the car, or just...
It was this amazing tool. Even like he'd be crying in the car, and I could reach back and pop a pacifier in his mouth while he's in the car seat behind me, and he'd be happy. And it was just like... Gosh, like what a wonderful tool that for us like became a little bit of a crutch, honestly, because we kept on using it.
Well, he loved it. And then by the time we're like, oh, he's 1, we really need to get rid of it. He really loved it. And then, the recommendation says
get rid of it by
18 months, and then he's 2. And I remember he did a bunch of like OT mouth stuff when he was little, and she said when he's cruising, like 6 to 8 months old, when he starts cruising on the couch.
8 to 10 months is cruising, somewhere along that.
Somewhere in the 8-month-ish range. She's like, get rid of it. That's the time to get rid of it.
We didn't do that. So, please don't feel any guilt from us. We let our 2-year-old still, it was so cute. He'd fall asleep. He'd have one in his mouth and hold one in each hand. And he would just go to sleep instantly. Yep. He was like the best sleeper with his passies. But then we started to see his teeth were changing. His palate was high arched. Like he was having his mouth shape is changing because
he was only using it at night at that point. It was, I'd say, at that 1.5 mark or before we'd said he can only use his passies for sleep, like for napping at night.
But still, we were seeing visible changes in his mouth. So then the question is, hey, if you have a toddler and you were like us, this is what a great tool or / crutch, what do you do? There are all sorts of fun strategies. One of the girls I work with, she just I just had my son throw his away. And we're not that good of parents or stern of straightforward of parents. Just we're throwing these away now.
And it just it's different for every kid, right? You've got to a little bit tailor this to what does your kid need.
Yeah, Bo was not going to handle
Right, so that. Cold turkey can be a thing. It depends on how old they are.
Some people you can snip just the tip off just so it's no longer something you actually suck and it just changes the experience, so then it's no longer enjoyable for them. Yeah. Or you could have the pacifier fairy come.
Which is what we did, and it was great fun.
So, Bo, compliment of the very creative mother that he has,
Passy Fairy,
got a wonderful card from the pacifier fairy that came with...
is that how it went?
A little bucket, yeah. And it said, Dear Bo. Why don't you read what the pacifier fairy wrote?
Dear Bo, I heard you want to give your passies to other little boys and girls who need them. That is so brave and kind.
Yes.
Here is a special gift for a big boy like you.
Yeah, so...
And then it said, please leave your passies on a bucket in the daffodils for me to pick up tonight.
Yeah, so it was springtime. It was kind of fun. We had this little bucket from Easter. Hey, let's put all the pacifiers in the bucket. Let's leave it out in the daffodils. And then the pacifier fairy is going to come take them tonight and bring them to little boys and girls that need them. And he was actually okay with it. You could tell he wasn't crazy about it, but also there was this, and he got, I forget what he got. He got a special shirt, I think, with this. I
got him new big boy undies.
Big undies, yeah.
Well, that's what she brought back.
Very cool.
And with a note and the undies the next day.
Yes. And if you're our 2-year-old did have big boy undies because we had started potty training at 1.5 years.
Yeah, he was potty trained before he got rid of his pacifier.
We've got a video all about that. Check that out too. Yeah. But then, so he left them.
Said to him.
So this is the next morning.
Yes.
We went to check out, and the bucket was out there. The passies had been replaced with big boy undies, and then the pacifier left
The fairy said, "Dear Bo, thank you for giving me your passies. I gave some to a family of bears with 2 little cubs. The mama bear was so glad to have some for her babies. They did chew a couple, as you will see. Here are some big boy undies for you."
Yes.
I love the passy bear.
And so you may notice we actually had to he was missing holding on to the pacifier passies too.
Yes.
And so we clipped the tips off 2 of them, gave them back.
Gave those back to him with the tips cut off, and I said that the little bears had
chewed them. That was our trick. If it helps you, awesome. If you're getting a good chuckle out of what we had to do.
It worked. It was hard. I would say it was hard for a week.
At least the first night or 2. And, honestly, like, his sleep is very different now.
Like hard forever. Now he sleeps with us half the time. Yeah.
So, he used to, just self-soothe and go right to sleep. Now, bedtime is different. And so, we lost that tool. But his mouth, actually, we've noticed in the last 6 months or so since this happened,
improved.
His mouth shape is changing. He still has tooth crowding.
Yeah, but it's better.
Yes.
Way better.
His dad needed braces, mom needed braces.
Yeah.
He may end up needing braces.
Sure.
But at least we got rid of it. Hopefully this is fun for you. Hopefully it helps. If we could go back in time, we'd maybe get rid of it sooner.
I don't know, but
it was such a great tool. I'm thankful that Hank doesn't like this, because it just means it
isn't a thing we're gonna have to do with him. So.
Cecilia, our oldest, has beautiful teeth. Her teeth are just straight; they're not crowded. Her mouth shape is normal. And so, how much that was the pacifiers? I think probably a lot, but we can't be certain.
Hard to say.
So, anyway, this is our story.
Good luck if you are about to wean the pacifier. You can do it. And some of these things, you just have to do it for your kid's well-being. And it was very easy to be like, his mouth is a little messed up. We need to fix this. And we're his parents and we have to do it. It's going to suck for a little bit. It's our fault. So let's just fix it. So anyway, you can do it too. We're right there with you.
I gave the bear family my pacifiers.
You gave the bear family your pacifiers? Do you remember that? What did you put the pacifiers in?
In a bucket.
In a bucket? And where did you put the bucket?
Outside.
Outside. Did you put it by the flowers?
No, we put it by the flowers.
Put it by the flowers. Oh, so fun. Did the little bears like your pacifiers?
No, the pacifiers came and got them and got them for the bear family.
The pacifier fairy came and got them for the bear family?
Sure did. And then did you get 1 or 2 passies back that the little bear cubs had chewed on?
Mm-hmm.
Yeah. Hopefully this quick little review of pacifier use was helpful to you and maybe a little entertaining as you watched Bo get rid of his.
The sweetest. Pacifiers are great. They are a tool. Be thoughtful about how you're using them, and hopefully this gives you some guidance on how to start using them and how to get rid of them when it's time.
Okay, thanks for following along. Make sure you're subscribed, like the video if you thought it was helpful, share it with a friend. We'll see you guys next week.
Bye.
We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.